I'm Dr. Aaron Brown. I'm a GP in York and also suffer with cystic fibrosis. I would like to truly thank all the MPs and people who were involved in last night's 3-hour debate about the use of Orkambi on the NHS for people with cystic fibrosis. I was really moved and touched to hear a group of people without cystic fibrosis campaigning for us to have something that could stop the clock on our illness. I'd in particular like to thank Rachel Maskell, who was absolutely brilliant. I met with her a couple of times, and I've never sort of met a politician smart, caring and proactive as her. And I also thank her for my shout out during the debate.
75 constituents of mine who have also signed the petition, not least the inspiring parents and patients, youngsters as well, who have really brought this debate to the fore. I particularly want to mention Dr. Aaron Brown, who is based in York and is living proof of what it is to live with cystic fibrosis. He himself was the first person to graduate to the Royal College of Surgeons and is a GP in York today. However, living with cystic fibrosis for him does ask many, many questions, not least as he has a young son and a child on the way. He says,
So, the stage has been set. It's all very active now. We need to keep it active. It would dissipate so much and we would lose so much if we just let this get flown away in bureaucracy and no action actually happen. Like was said in the debate, every minute counts. Every second, every minute, every hour, every day, we are losing people to cystic fibrosis. Every minute, every hour, every second of the day, people like me with cystic fibrosis, their lungs are getting more damaged, and that is irreparable. Orkambi cannot reverse what has gone wrong in our chests. It can only halt. As long as I've been alive, I've been promised a cure to CF. We went through gene therapy a decade or so ago. It was all very exciting. We'd all get a spray in our nose that would cure us from CF. But we've had hopes raised and hopes dashed. And I really hope this isn't one of those times. We had Orkambi 2-3 years ago, and it was the first drug that's ever come out that gave us hope. It was different. It wasn't just treating the symptoms, it was treating the underlying cause. And it was exciting, almost too good to be true, and we haven't got it for many reasons. I'm a GP and I fully understand health rationing and that we don't have infinite resources. But I think, as been made yesterday, there are very strong arguments, although it's expensive, and hopefully with the work with Vertex we can reduce that. But if somebody's having 3 or 4 hospital admissions a year, if you consider that £400 average a night in a hospital, if any of them need ICU or HDU, it goes up to about £1,200 a night for that. The antibiotics that are administered at home is a great service. It is a private company, so we do really get a Rolls-Royce service there, so there would be savings there too, and all these things. But also, we've got a generation, I think like me, we've got people who are born with this sort of Damocles above their heads, and we're told, yeah, you've got about 30 or 40 years, what do you want to do with them? And a lot of us like me, I've spent most of my life fighting against it, almost, and saying, no, I won't let this get me down, I will achieve. I think that's the drive of where I am today. But we've got a generation of people in their 30s and 40s now who are usually quite high achievers. And from a society point of view, if we are just to let them wither and die, sorry to be dramatic, but that's what it is, then think of the financial implications of that. Think of they'll go on care packages and require more and more aggressive treatment. Think how much a transplant costs, and we'll lose that generation. But if we imagine if we can stop the clock on this illness, we can. It's unfathomable for somebody to tell me that the clock has stopped and I'm not just going to deteriorate and live a normal life. Orkambi doesn't cure CF, but it certainly does. Should reduce the deterioration. So that's the importance of it. I don't want to get too emotional in this, but certainly there are, I've got a 2-year-old son and I've got a daughter who's due to be born on the 11th of May. And you could say there's a very slim chance of me walking her down the aisle. But Orkambi could make that a reality. I'm sorry. But anyway, I think we need to all really drive forward, not just for me, but for everybody and their families, the importance of the Orkambi debate and pushing it through to actually get this drug to the people who need it. On a lighter note, I will leave you with the best 3 seconds of the entire debate from the MP Bob Stewart. Take care. Bye-bye.
Lungs don't work well when they're drowning.